I'm a student nurse, so today we're going to be doing a central line dressing change. Before we begin, can you give me your first and last name and date of birth? They're going to give it to me. I'm going to say, okay, great, wonderful. I'm going to wash my hands. I'm going to don gloves. I'm going to say, okay, great, thank you for your name. I'm going to gather my equipment, make sure I have everything that I need. So I have my...
Thank you for your name.
I'm tired, man. Thank you for your name.
Dead.
So I'm going to say thank you for identifying yourself. I'm going to make sure I have all my equipment. I have my, what is this called again? I have my bio patch. I have my port, I have my cap, I have my syringe, my mask, my tegaderm, my kit, my gloves, my regular gloves.
Clean gloves, yes.
Cool. I have everything that I need. So I am going to wash my hands. Okay, I'm going to put my gloves on. I'm going to mask myself and my patient. Let's say these gloves are on, they're not fitting me. So we'll just say I have gloves on. I'm going to mask myself first. And then my patient. Gucci, Gucci. Cool. So then, now I'm going to, with my gloves on, I'm going to remove the old tegaderm, and I'm going to roll from the outside, underneath, and making sure not to peel at any of the skin or the ports.
Wait. Before you remove the dressing, you were supposed to assess the site for infection or before you remove the dressing.
Okay. So I'm going to backspace. I have all my equipment. Patient is masked. I'm masked. So I'm going to remove the dressing. Prior to remove the dressing, I'm going to look for any redness, any infiltration at the site, any bruising, bleeding, anything of that sort of nature.
Yeah.
I don't see anything. We're good. So now I'm going to take off my dressing. Need to work on this one. With my gloves, and then I'm going to toss this. And
What
then
up?
I'm going to remove my bio patch as well, because there is a bio patch here. Toss that to the side. I am... Do I do sterile gloves yet before the chlorhexidine?
So, no. So when you remove the patch and the dressing, that's when you remove the glove and then dispatch it.
Okay.
And then open the kit without contaminating anything. So you open this kit first.
Okay, so I'm gonna prep my items prior to that. So what I'm gonna do before I open my kit is I'm gonna prep my port. So I'm gonna crack this open. Get this
you can do that.
go in there, and then I'm just gonna set this to the side. Okay, and then I have my cap right here. So now I'm going to open my kit. Sterile technique.
So at this point, you don't have any gloves on right now.
Yes. I disposed of my gloves with the dressing.
Yeah.
So maintaining sterile technique. So, and then I'm going to put my gloves on. Okay, I'm going to put my gloves on, my sterile gloves, making sure not to touch Sorry, these are taking a second.
It's okay.
Bring this down all the way. Make sure my fingers are tight. There's no loose. Toss that.
Yes.
I'm going to bring my kit closer to me. I'm going to put my bio patch into my kit.
Just put it in. There
Okay.
you go.
I have patches in my kit. So I'm going to toss out anything that I don't need, which is going to be the masks. Toss. I'll put them nicely so I don't see your stuff. So then I'm going to grab my chlorhexidine. I'm going to break it in a downward angle. And I am going to clean in one motion, right? Okay, all around the hashtag. And then I'm going to do one clean swipe.
Under this too. Under this.
I'm going to get underneath as well.
And then you go over.
And then I'm going to do one clean swipe overneath.
Yeah, overneath.
Over the port in the lines. Perfect. Okay, I'm good with that. I can toss it. So now I'm going to let it dry for 2 minutes. As it is drying, I'm going to make sure that after it's dried, I'm going to make sure that all my ports are clamped. Except for the one I'm going to be working with. So now I'm going to take...
Oh no, not yet. You have to apply the bio patch first. Yeah.
So now I'm going to take my bio patch. I need to work on this one a lot.
Yeah.
I need to take my bio patch after it's been dried for 2 minutes.
And then you put the dressing on.
And then what the hell? Okay, let's pretend the Tegaderm was already in there, which it would be. So I cleaned, I swiped, I let it dry for 2 minutes, I reapply the bio patch, and now I'm putting Tegaderm on.
So just remember, before you do anything with this, you have to put the dressing on first because you don't want to contaminate it.
Okay. That makes sense, yeah.
Yeah.
So I'm going to make sure to put my dressing on firstly. Make sure my ports are organized. Oops. And then apply my dressing, make sure it's tight. Okay, and then I'm going to tear this off.
Perfect.
And then I'm going to save this label to the side because I'm going to label it for my patient. I'm going to put it to the side and I'll write on it and then I'll put it back on my patient. So now I'm going to make sure all my ports are clamped except for the one that I'm going to be working with. So I'm going to unclamp that. I'm going to be holding this with one hand. I'm going to take the lid off. I'm going to use alcohol wipes and I'm going to clean the port and let it dry.
Oh, that's right. I didn't do that.
It's okay. So I'm going to let it dry 10 to 15 seconds. Make sure you're making sure not to air dry it. And then I am going to continue to hold. This is what I was trying to explain to you. That hold it like this and use your other fingers to take off. Sorry, I didn't know how to explain it.
No, that's fine.
Instead of like popping it, just almost hold it like a cigarette. Cigarette hold. And then you can do that. Because look at, you're still like holding everything up. So now I'm going to attach this to my port. I'm not going to aspirate, but I'm going to flush the line. This is a normal patient. I'd be doing the entire syringe. I'd be doing all 10 milliliters, but I'm not. Did I just port to port? I port to port. Retard. Sorry. We're going to start over again.
Start over. I know that's the part that confuses me, like which end and stuff.
My bad, my bad. Okay.
So first, you take out the whole thing.
Okay. So,
Boom.
boom. I don't need to do port to port. That makes no sense. I don't need to even uncap this. All I need to do. Jesus Christ. There you go. I need to take my port off. Toss it. I have this cigarette hold and clamp. Put the new port in. Make sure it's tight. Flush. Gucci. That popped off. And now I'm going to cap it. We're good. I'm going to clamp this port. Now that it's done.
That's it.
And then I'm going to take my sterile gloves off. I'm going to label this, put on the patient, document what I did.
Okay.
Is that it?
Yes.
Okay.